What's up? So I am going to be online today with my Whitman-Walker team. We're going to be talking about the flu vaccine and why it's important to actually get that vaccine. I know a lot of people think it's taboo and that they don't need it. And so I want to share my public health resources and let you know how important it is to actually get that vaccine. So I'll have someone special join in and we'll do a Q&A about it. Hey, how's it going, Lindsay?
How are you?
I'm good. We'll give a few moments for folks to join, but I'm happy you could do this today.
Glad to see you again.
I know it's been a while since we've done one of these,
Yeah.
so this is going to be good. Um, so I already let people know that we're going to be talking about the importance of the flu vaccine and why folks should actually consider getting that. And the structure of this live is, we're going to do a little Q&A. We ask that you participate in the comments, and Lindsay will give us the correct answers because she's more of an expert than I am. So again, we're here with Whitman-Walker Health today. I know this Instagram is started from my life, but we also have Whitman-Walker joined in with Lindsay on behalf of Whitman-Walker. So um, if you don't know me, I'm David Wilson. My pronouns are he, him, his. I am an influencer on the public health team at Whitman-Walker, the community health team. And Lindsay, I'll let you introduce yourself.
Hi, I'm Lynsay McLaren, pronouns she, her, hers. I am a physician assistant at Whitman-Walker. I've been there since 2010. Currently, though, I am spend more time in research, where I'm a research clinician as well.
Okay, yes. Hi, Lando. I see some of my fellow team members joining on live. So again, today we're going to talk about the flu vaccine. We're going to do it in a little quiz type of way. I want you all to play along, answer the questions in the comments. We want to, debunk some of the theories and myths that people have about getting that flu vaccine. And so this is why we are here today. Anything you want to add there, Lindsay?
I just want to emphasize again that the flu vaccine is an incredibly important tool to keep people healthy and safe. Influenza, or AKA the flu, it's a serious disease that people kind of can take for granted. So just to throw out some statistics, in 2017, 2018, the virus infected around 45 million Americans and hospitalized about 180,000, killing 61,000.
Wow, that is a lot of people. So I'm sorry, can you repeat the numbers again for me? Because
Yeah,
that's a lot of people.
a lot of numbers to throw out at once. So the 2017, 2018 flu season, which is probably what we have the most up-to-date records on, the virus infected 45 million Americans, hospitalized 810,000, and then killed 61,000. So experts predict that the flu could be particularly lethal this year because healthcare resources are already strained because of the obvious COVID-19 pandemic that's going on. So
Mm-hmm.
the single most important thing you can do this year and every year to protect yourself is to get the vaccine. But
Exactly.
there's so many myths and misconceptions out there, so it can be difficult to know how, when, why to get one. So kind of wanted to talk about that a bit more.
Yeah, absolutely. And so, again, we're going to do this in like a quiz type of format. So I'm going to pose a question with the answers, A, B, C, D, and you put in the comments what you think the answer is. And then we'll have Lindsay actually give the answer, and we'll know if you are correct or not. So let's start. So the first question is, what are the benefits of getting a flu vaccine? Or is it protection from getting sick with the flu. That's A. B, reduce severity of illness if you do get sick with the flu. Or C, protection from people around you. So, and then the last option, D, is all the above. So what do you think? Yes, you can ask your questions, John. So what do you all think the answer is to that? Again, what are the benefits of a flu vaccine? Is it A, protection from getting the flu? B, reduce severity of the illness if you get sick with the flu? Or C, protection from 4 people around you? Or D, all of the above? What do you think the answer is? B. Someone said B. All right. Any more answers? John, what's your answer? You're engaging with us, but not following the rules. The answer is always D.
Always D. Always all of the above, huh? All the above. We got some more of those.
Yeah. Okay. Lizzie, what is the answer?
The answer is always D, all of the above. Well, in this case, anyway.
Yeah.
So the flu vaccine has many benefits, including, of course, protection from getting sick with the flu. That would be hopefully the point of it, the main point. But it also can reduce the severity of the illness if you do get sick. And if it reduces the severity of the illness, it's probably likely to reduce any flu-related hospitalizations for anybody. So that's children, working age adults, or even older adults that can be particularly at risk.
Right.
And protection from other people around you. So you can often, when you go to a pediatrician, if you have children, they're going to tell the parents the number one thing they can do to protect to get the vaccine themselves. And then again, just even vaccinating children is also going to further prevent having really bad consequences. That sometimes the flu hits kids hard, sometimes it hits adults hard, sometimes it hits older adults hard. It kind of has no preference.
Yeah. No, that's I mean, that's great. There are a lot of things that the vaccine can do for you. Some of them I never knew, actually. I didn't know that, Lizzie. So the next question, moving on to question number 2. This is a little easier because you have a 50-50 chance of getting it right. So true or false? Flu vaccines carry serious risks. Is that true or is that false? John, I'm interested in your answer. Give me something witty. I have my guess in my head.
I feel like we should have Jeopardy music right now. Any other?
I know.
Throw it out?
No one's saying anything. People are being boring. False. You're just being. So, Lizzie, what's the answer to that question? I feel like I've heard that flu vaccines can be dangerous, but why don't you tell us a little bit about that?
So the answer is false. Vaccines do not carry serious in general. So they're tested by the FDA. They meet very strict safety and quality measures. Hundreds of millions of individuals, just not in the U.S. but around the world, get these every year. But anti-vaccine information, I think you think otherwise.
Yeah, that's actually surprising. Surprised by that answer, but that is good to know. So, are there any risks for getting the flu vaccine?
Well, usually there's mild side effects that can be associated with it. So, very soreness of the site, some headache. You might get a allergic reaction if you're allergic to some sort of component of it. So be sure to tell your provider if you have any allergies. The vast majority of people don't really experience any side effects, and the only benefit is it protects you. Some people often feel that they get sick from the vaccine, and have to kind of tell them what they might be experiencing. Hey, there's always cold going around, so maybe it's just a cold. But also your interpretation of your immune system ramping up is when you get sick. So sometimes people people can feel like they're under the weather or just feel off. And in usual context, that means you're getting sick. But in this context, since you got the vaccine, it could just mean that your immune system is preparing all its little fighters to fight what it thinks is an infection, but it was actually just the vaccine.
Gotcha. All right. Thanks. Now moving on to question 3. This is a good question. I like this one because I feel like I'm slightly hypochondriac. First of all, if I like have an itch in the back of my throat, everything's COVID-19 right now. And so, with this question, how can you differentiate between the flu and COVID? Is it A, COVID has a faster symptom onset than the flu? B, COVID presents itself with a cough, the flu doesn't? C, COVID symptoms are much more severe than flu symptoms? Or D, you cannot conclusively differentiate without a test? Answer that question in the chat. What do you think, John, the perfect student? Is that going to be... Is that going to be a B, C? Got to be D. All right. You might be right. What do others think? So, I feel like I said, I feel like I run to this question before where, I might have a sore throat or that itchy throat or, any symptom that I can't tell whether or not it's a minor problem or whether I should be concerned that it could actually be COVID. And so I would love to know this answer. I was literally telling a friend like yesterday, like I got really tired and I was like, I don't know, am I going to get sick? Like, how do we know?
So the answer, once again, in this test anyway, is always D. So you can exclusively differentiate yourself just by your symptoms if you have the flu or if you have COVID. Flu symptoms and COVID symptoms can have much overlap. So there's the fever, the sore throat, the cough, the fatigue, the muscle aches, the pain. Both of them can cause that. So it's impossible to rule out with a diagnosis without a diagnostic test. And the other part to throw in here that could be a wrench in it, all of it, is you can get both. So even when this all started, when flu season was still active, people were testing positive for both. So
oh, wow.
If you're not feeling well, you're going to make an appointment to come in so we can kind of tell you what's going on.
Yeah, that's crazy. But thanks for sharing. I think it's good that people know that that's a possibility. Yeah, someone said they have to get a COVID test every other week, and it's sorry that you have to get it every other week, but I'm sure it's like helping keep everyone safe. So I've actually heard that people, with COVID, and this is true story for me at least, that I had a cousin who was actually planning to come into town, and he canceled his trip because he was like, I can't smell or taste anything. And I was like, yeah, you're not coming here. Like, stay where you are. So is that, that's not usually a symptom for the flu, right? Like loss of taste and smell.
Yeah, not that I'm aware of as abrupt and complete as it seems to be with COVID. It's a very strange symptom.
Mm-hmm.
So sometimes if people have a cold, they can get stuffy, so their taste and smell is decreased. But this isn't like the stuffiness is not what's causing the COVID lack of taste and smell. It's something else. So it's pretty striking. But even with that said, like how I just said, you can get COVID and the flu at the same time. You can have the flu and the cold at the same time. The cold can be causing congestion that reduces your sense of taste. So you're again not just by that. You're gonna want to come. Either way, you're gonna want to come in and talk to somebody and get.
Yeah, got it. All right. So, well, now I'm not trying to get sick this winter, and so I do want to keep the questions moving forward. So, question 4: when is the best time, or when should I get vaccinated? Is it A, in August, B, September through October, C, November, D, December through January? What do you all think? I have my guess. It's actually interesting because I've had 2 flu vaccines this year. And I don't know if I currently have the current strain, I guess, or whatever. I don't know. Like, I feel like I do because I got one in the winter, but then I got another one like maybe towards the end of the summer, like maybe like July-ish, August or something. Yeah. But so when should I get vaccinated? Is it A, August, B, September, October, C, November, D, December, January? I want you all to answer that question in the comments. Let me know what you all think.
Well, we're waiting for people to respond. The newest flu vaccine was definitely not out in July. So if you got a vaccine in July, that was the old one still. So it usually goes at least till August. So I'm not sure.
I'm gonna check my record, but I feel like it was like July, and I feel like it was. I was told that it was a new one. I don't know. We're gonna figure.
It was. I've never heard of the flu vaccine coming out in July, but who knows? So who knows?
So some people are saying September, which is now. They're probably like, yeah, you're having this conversation right now, so that makes sense. But some people are saying November. I see the C. Someone said September 22nd, 2020. Yep, today is the perfect day. So what's the answer? What is the correct answer?
So the recommendation is more now, so like September, October. So go out and get it. Flu season usually starts, I would say, end of October, and the vaccine takes a little bit of time to get up to full capacity to prevent you from getting sick. So always just kind of remember fall in your head. First day of fall is what? Is it September 21st? Is that we just have fall? So just right up there, that's the time. So CDC recommends the flu shot by the end of October. Lead more towards October. I used to be the first one in line to get it. Like, as soon as it was out, I was there to get it. But there is more and more evidence that shows that the vaccine can wane actually over the season. So if you get it too early, like in August, if you end up getting exposed to the flu in January or February, it could kind of not be as protective. So trying to get that sweet spot end of September, October, get it in last season. But with that said, if you have an appointment end of August with your provider, you're going to get it.
Yeah.
Also make it what's convenient for you, because if you don't get it, if you're like, oh, I'll wait till September, I'll go back and get it, but you're never going to go back and get it. So we want you to get it, ideally September or October, but the most important thing is getting it.
Yeah. So since we said answer is B, September through October is the ideal time to get it. Does that mean if I miss this September October window that I still haven't gotten my vaccine, by November or like December, like does that mean skip it? I guess you kind of answer that, but
we definitely want you to get it no matter when you can get it. So if you haven't in November or December and you haven't got the flu yet, great, you haven't been exposed to it. It doesn't mean in January you're not going to be exposed to it. So get it when you can. If it's being late, November, December, that's fine. Do it. It'll protect you through the next few months where the flu virus may still be active.
Gotcha. All right. So I have one more question. What percentage of Americans get the flu vaccine on average every year? So what percentage of Americans get a flu vaccine on average each year? Is it A, 25%, B, 45%, C, 65%, D, 85%? Again, A, 25%, B, 45%, C, 65%, or D, 85%. Answers in the chat. Thank you all who are constantly participating. You are making this fun.
I have my wish answer, which I don't think is the answer.
85%. Wow, you think it's that many? 25%, 45%. Somebody's Googling answers. We got some cheaters on the line.
Or their stats.
Or that, yeah, let's give them the benefit of the doubt. They're just, well prepared for this conversation.
All right. Anything else? Any
All
more
right.
guesses?
So let's see. Do we have any more guesses? I wish I had the Jeopardy kind of like sound. Yeah, that would be great. All right, so how did the audience do? What's the answer?
We had somebody that guessed the right answer. It wasn't even a guess. The answer is 45%. But kind of talk about that a bit more, because that's just a general number, right? So 2017, 2018, if you break down demographics, 37% of Hispanic Americans and 39% of Americans received the flu vaccine. And that's compared to 49% Americans. So the CDC is making 30 million more doses of the flu vaccine than last year to really push the vaccination rate up to at least 65% among all Americans. And again, that's now more important than ever, and especially people of color must get vaccinated. And it's just important for everyone all around.
Yeah, absolutely. All right. So that pretty much wraps up our trivia session. And I feel like I learned a lot during this trivia session. I mean, especially the amount of people who actually are impacted by the flu itself. I now know that the flu vaccine has many benefits and that it is generally safe to take. So I think I'm going to try to get vaccinated ASAP, especially since I gained knowledge that the vaccine that I got probably isn't the newest strain. So I definitely encourage my friends, my family to do the same. Please go out and get vaccinated, especially right now during the time of the pandemic is even more important. And yeah, so thanks, Lizzie, for sharing all of your information.
Of course. So yeah, and even if you got it in July, it's going to wane. So you want to get it anyway.
Yeah.
Protected. And it's just so crucial, again, not only to your health, the people around you. If you can't get it, then you're going to stop somebody else from getting it, which is important. And if you're wondering where to go to get vaccinated, you can check out, we have a pinned comment about vaccinefinder.org that lists the places where you can get it. Little Bug told me, I think next week we'll start having some like flu clinic hours at Whitman-Walker. So don't call this week, maybe call into next week to figure out when you can get an appointment even at Whitman-Walker to come get that done. It won't be with the provider, it'll just be with one of the medical assistants. Mm-hmm. Sorry.
Yeah. Cool. So if you all, have any questions or concerns, I do want to let you know that Whitman-Walker Health is absolutely here to help you. Right now, we are open for symptomatic testing of COVID-19. So if you are experiencing popped up. So if you are experiencing symptoms and you think that it could be, COVID-19, please give us a call at 202-797-4439, and we could possibly get you in for a same day or next day appointment. Again, if you need additional resources outside of those, you can visit whitmanwalker.org/pharmacy for any of your pharmacy resources, or just visit whitmanwalker.org in general for all of the resources that we have available. So during the past few months, our community health team has expanded its outreach. This is why we're here on this social media platform. We continuously cover various topics that could be HIV, STI, sexual health practices, access to care, social determinants of health, and as well as just general public health interventions. So continue to tune in to my Instagram Live, follow Whitman-Walker here as well. You can follow us on Twitter, Facebook, here on Instagram. Also follow me on those platforms because I'll be sharing more information about what we're doing here. I want you all to know that the community health team is here to support and help you. Anything from you, Lynsay?
That's it. Just thanks so much for having me. I was just scrolling through to see if we missed any questions. I don't think we did. If anybody else has any other anything else. But yeah, thanks so much for being in. It was great to be here again, and look forward to talking with everyone again at a different time. You can get this.
That's a good question. John just threw one in
Yep,
there.
of course. Even more reason you're going in to get your prep, so get the flu shot while you're there.
Absolutely. So if you're on prep, you can get the flu shot as well. You can also, if you're interested in getting on prep, you can find out more information about that on our website. Yep. So yes, you can, John. Thank you. And have a great day, everybody.
Yep. Thank you.
Bye.
Bye.